Good afternoon, everybody. Thanks again for being here today. This is our opportunity to update the community on what's happening related to COVID-19 in Eau Claire County. We are here really to share with you the most recent information that's local. We are also here to share some perspective from across the community. And we're fortunate today, not only will you get an update from me today, but also we have Superintendent from Fall Creek, Joe Sanfilippo, here with us today to share a little bit about what schools are doing to support our families and support success as we go through this difficult time. As a mother of 4 children, I know that it's tough when kids are impacted in this way. Luckily, my children are out of the early years of school, but it's tough. And so hearing that perspective, it will be helpful as well. A couple of updates before we get to that. In Wisconsin, there are now 1,730 positive cases tested for COVID-19. 31 deaths, an increase of 7, certainly a concerning number, and 20,317 negative tests. This is a disease, like any disease, that any death is a failure of our system in some way. We knew that there were going to be cases increasing and deaths increasing, and it's hard for all of us to hear that. We also know across the state and in Wisconsin, in Eau Claire County as well, that not everyone is being tested. So that number of more than 1,700 positive tests does not indicate to us how many people likely have COVID-19 in Wisconsin. There are likely many more positives, those people that have no symptoms or mild symptoms, or those people that have symptoms that can be easily managed at home that are not getting tested. We still encourage people to call their provider if they have symptoms that are worsening, and to talk through with their provider what that next step should be. Testing is still prioritized for those that are at highest risk. That's partly to manage the volume of testing happening, but it's also to really make sure that we are treating people successfully because we know what illness they have when they're hospitalized. Testing is increasing in the Chippewa Valley. Prevea has opened their drive-through testing we were notified of today. So that's an additional resource for testing, and certainly contacting them as well as our other outlets for testing across the community for those tests that are necessary is certainly encouraged. In Eau Claire, we have 16 confirmed cases of COVID-19 for Eau Claire County residents. Again, those are residents with those are people with an address in Eau Claire County, not people that have been tested here, nor people that have been hospitalized here if they were not Eau Claire County residents. Our testing numbers are at 745 individuals tested. Again, we are increasing those numbers daily. There was an increase of 53 tests done today. 549 negative tests, and the remaining of the tests are yet pending. We need still to prioritize those tests, and that is, again, a reminder. Just also a reminder that many people may be describing in public that they have COVID-19, and we've seen that at times, sometimes for a variety of reasons. Some people who are contacts of cases of COVID-19 may describe themselves that way. So a reminder to the community that we do notify all contacts of cases of COVID-19. They are told to self-quarantine and monitor their symptoms. Those are not considered cases, and those are not counts that we release. We also had 70 calls to our call line yesterday, and a majority of those calls are related to the order, the stay-at-home order. A reminder, because of the calls we got yesterday, that while the weather is improving, social activities outside are encouraged with your family unit, with the group of people that live in your household. Golf courses are not open, And those congregate events that people do like to do outside in large groups, and we all enjoy that, are not permitted during this time under the stay-at-home order. So again, stay at home unless you are providing an essential service or you are going out to do an essential activity. We strongly encourage people to do that as a one person per household in those circumstances where they're able to do that. Not everybody is able to go out just by themselves to pick up their medications or pick up their food, but we strongly encourage that happens whenever it is possible. We also strongly encourage people, whether it's in your essential work site or when you go out in public to an essential location, that you use physical distancing as our primary way to make sure that we do not spread disease. We know people are missing social activities. It's hard on all of us, and we understand that. This is our best way to make sure that we flatten that curve. A couple of additional updates today. Again, we've talked previously about the elections. That is a large effort happening in Incident Command right now, making sure that our poll workers are assured of being safe in the important and critically essential job that they do. They are receiving supplies, they are receiving ways to set up their operations, and we are walking through those operations with all of our poll sites over the next number of days. There's also a public service announcement, a little video that's being crafted and will be available if it's not already available. That was done today to really help people understand not only how are we keeping poll workers safe, but also how are we keeping voters safe as they come on site to vote if they choose to vote in that way. A reminder that today is the last day to request an absentee ballot, April 2nd. And those ballots need to be returned to the polling site by the election day next Tuesday. We do encourage people to try and vote absentee. That process can be done safely with someone witnessing your ballot, and if you have questions about it, please don't hesitate to ask. Call someone and ask them how to walk through that. People that are living alone, there are ways to have a video chat with someone to watch you sign your ballot and then pass the ballot out through a doorway and have that individual sign your ballot as your witness. We really encourage people to continue to find safe ways to do that, as well as make sure that they find safe ways to get to the election and vote. Anybody that is ill is somebody that should stay home in all circumstances, and we understand that that is an incredible challenge. So I'd like to introduce Dr. Joe Sanfilippo. He is our superintendent from Fall Creek, part of our Eau Claire County community, and he's here to share with you a little bit about schools.
Hi, everybody. So before we even get started, I can't speak for educators across the country, but I can speak for the educators in Fall Creek, Wisconsin. And from the bottom of our hearts, we just want to say thank you to all the healthcare providers who are putting themselves in harm's way to make sure that the rest of us are safe. So thank you. Your work does not go unnoticed at all. You are true heroes. Continue to do the incredible work that you're doing, and we will try to do the best that we can in supporting that. So when it comes to the school updates, one of the things that's really important about the work that we're talking about here, the first and foremost thing that we want to get out there is that we have to acknowledge that families have been absolutely thrown into disarray over the course of the last couple weeks. And our job is really to serve families, which means we're doing everything that we can to meet their needs. And when it comes to meeting the needs of families, I want to be very clear about meeting the needs of families. That need for safety and belonging comes way before we even touch the academic component of what we do. So in thinking about how lucky we are to be connected to educators across the country, one of the things that was really important was really kind of coming down to the core of who we are from an education standpoint. And the two questions that we want to make sure that we're thinking about moving forward is, how are we taking care of kids and taking care of the people who take care of kids. So we actually posed only two questions to the people in our area when it comes to how we're moving things forward in talking about moving school from our facility to home. And those two questions were to all of our kids and all of our families. The two first questions that we asked were, how are you doing and do you need anything? How are you doing and do you need anything? Are the first two questions that we want to make sure that we have answered, because from a belonging standpoint, from a food standpoint, from a connectivity standpoint, they can do nothing academically until we feel like you're connected in some capacity. So when we identify those items, then we're able to really kind of move forward in terms of how we're going to educate the student. So those two questions were asked to our community just to make sure that they had everything that they needed, and then we kind of move forward from there. So when we got into the academic piece, or the advice that we would give to families when it comes to moving school from school to home, one of the things that's really important, we believe, is to develop some kind of daily routine, or in terms of the work that happens every morning on our Facebook page. We start our day with a story to kids, 8 o'clock every morning, and the story is really great to get the story started for kids, and it's great, but it also gives parents a half hour to just break away, get some coffee, relax a little bit, and just kind of start their day in a timely fashion. The other thing that we really want to talk about when it comes to educators is really speak from a standpoint of making sure that you're consistent within the context of your district. And if we think we're going to throw out all kinds of material throughout the course of the day, we have to be really cognizant that the people who are taking in all this material and content are also now de facto primary caregivers for kids in their houses, because their adults are out working or have other things that they need to be doing. So the thing that I think we really need that we kind of came across from our standpoint is this brought a few things to the surface when it came to working with kids in schools, and it asked two very important questions that we needed to make sure that we answered. And the first question was, how well do we know our kids? And the second question was, what are we willing to do for them when they're gone? And I think what it comes down to for us is just making sure that those two questions are answered unequivocally in terms of the connection that we have to them and what we're willing to do for them when they're not there. And if we can answer those two questions and be connected, I think we're going to be in a much better place. So one of the things that we've been telling our staff, and I would encourage all educators across the country to do this, is just think about it like this. Like, we can't do this wrong if we're connected to kids. We can do this wrong if we think we're just going to throw out content and expect them to do it. The connection to kids and to families is paramount, and if we can keep ourselves in that mindset, we're going to be just fine. We're going to be fine. We're going to take care of it. We're going to be fine, because we have the support of the community in terms of what we're doing moving forward. So thank you to all the healthcare providers. Thank you to all the educators across the country. Thank you to all the people in Fall Creek in terms of what they're doing. And we're just going to keep moving forward and make sure that we provide the best opportunity for kids that we can in a situation that's not ideal for anybody. So thank you very much.
What a wonderful series of questions to ask anybody in our community. So I think that's a great model, not just for kids and families, but anybody that you run across. So thank you for that, Joe. People that are seen, we know that they can be more resilient. There's actually very strong research for that. So the fact that Fall Creek and many of our educators are seeing their kids, they're noticing them, they are knowing them, is an amazing strength in this community. So we're very fortunate. Thank you for the work that you're doing. To just wrap up our formal comments, again, a reminder that our website is a resource for all of you. We are updating that multiple times a day. That is coronavirus.echealth.org, coronavirus.echealthdepartment.org. The COVID call center remains open, and that number is 715-831-7425. Our ask of you is that you first look at the website, try and get your question answered there, and if it's not answerable in a way that you feel confident about, do call that number and someone will talk to you directly and walk you through it. We want you to stay safe, so please focus on that. We want you to stay well, both physically and mentally. Find ways to do that as well. And we know it's hard, so find ways to connect. And we're available now for questions. Yes?
Did you just want to comment real quick on recent reports reports saying that it may get to the point where they're going to require pretty much everyone who goes outside to wear some type of a mask over the cases. You guys have always talked about the social distancing being the most effective, but now it's like it's getting to the point where they're going to suggest pretty much if you go outside, you should wear some type of mask. Just wondering on your comments on that.
Sure. So the question is, will we get to a point where there's a recommendation that anybody that goes outside should wear a mask? That is not part of CDC recommendations right now. That is not part of the state recommendations. And we certainly in Eau Claire also do not recommend that. There are, first of all, many challenges with wearing a mask correctly and utilizing it correctly. And it actually could be a spot where people actually get sicker because of disease transmission, and we do not want that to happen. We will see where this goes next. That's one of the pieces of research that our team and teams across the country are doing to really think through what happens after the stay-at-home order. What do we do next to control disease? And this is an unprecedented disease process for all of us, and we are learning, but we are also planning forward and planning ahead. Yes?
I have a question. If someone, dies in Eau Claire Hospital from COVID-19, but, is from another county, how will that be counted, and will we be notified?
Sure. So the question was specifically related to a death, what happens with the death in this example happens in Eau Claire. If the individual dies in Eau Claire County at an Eau Claire County hospital, for example, they will be reported in every case in their county of residence. So whatever county they reside in, even if they die in an Eau Claire hospital or in an Eau Claire facility, they would be counted in that county as a death for that community. So only Eau Claire County residents will be counted in any of the numbers that you hear from me. Other questions?
I have one for Joe.
Yeah.
Joe, can you speak just a little bit? I don't know the map well enough to know, but I know that broadband is an issue in much of rural Wisconsin, and that has in some cases hindered either laptop access or broadband, like inability to use that, has sort of hindered the ability to try and carry on learning at home.
Yeah.
Are you guys facing that, first of all, in eastern Eau Claire County, and then to what can you do about it?
So the question is, in terms of access in rural areas, what happens to kids that don't have access in rural areas in terms of this, academic work that they're doing? And the first and foremost, one of the things that was really important, and one of the questions that we asked, or one of the things that came to the forefront in terms of us being away from school, was that first question: and how well do we know our kids? Because a lot of times they're not willing to just say that they need help. There's a lot of pride in our community, so we wanted to make sure that we knew them in terms of knowing what they need. So we asked, and then we kind of asked around, and we got to the point, like in our school district, we handed out 50 hotspots to people that needed connectivity. Still not enough at this point, so we're going to continue. We ordered 25 more. They're all on back order at this point, so we're looking at a couple weeks for those to come out. We're actually looking at a couple different services, because some areas, some cellular services don't work in some areas and others do. So we're looking at those items as well. But what it comes down to is the connection to the families is paramount. So our job is to make sure that our families are connected, and that means that doesn't mean an internet connection. That just means a connection to school. And if they don't have an internet connection in terms of the work that we're doing, we need to make sure that we get them the work, the academic work that they can do at home when it's not online. The thing that we've talked to our staff about is making sure that there's not a tremendous amount of synchronous activity when it comes down to the work that's happening. So a lot of our lessons are going to be done asynchronously, so parents and kids and high school kids can do their work at different times throughout the course of the day, because again, a lot of those people become de facto caregivers throughout the course of the day. So we're trying to avoid that piece of it. We're also trying to make sure that the information that we're giving out in terms of lesson is built into a 5 to 7, maybe a 12-minute block, and then availability for, and done on a video perhaps, that can be emailed emailed out or sent out, and if that can't be sent out, to make a call to the family to make sure that they get the information that they need. It's definitely an issue, without question. And the more that we can talk to legislators, and the more that we can talk to the federal government in terms of making sure that those areas are covered for our kids, is certainly going to be productive. We were on a call last week with two members of Congress just talking about what we could do to get more devices into the hands of people, but that's not even the issue. The issue is making sure that those devices can connect. Yep, no problem.
Joe, I got a question.
Oh, yeah, absolutely. Go ahead.
Have you heard anything from the state level regarding how they're going to handle, I don't say makeup days, but
Yeah.
Once the school year is officially done with, I guess, what their plan is for students, if they're going to count all of this for their days of attending school, hours of education, or I guess can you?
Oh, absolutely. So the state has offered an opportunity for a waiver, for an instructional hours waiver, which the school district of Fall Creek did fill out. One of the things that was important for us is that we filled out the waiver in case we couldn't meet the number of minutes. One of the things that was important to us over the course of the last year was providing an opportunity for our kids to learn when we didn't have school, specifically because of those snow days last year and those cold days last year, where we ended up kind of adding minutes to the end, and we didn't want to do that again. So what we did coming into this year was to provide, we asked our staff members to provide 3 flexible learning days, online days. So they built out platforms for those 3 days, which was actually very helpful to us in the first 3 days that we had kids away, because we already had those platforms built and we had people, ways to connect in them. So I think we felt pretty good about where we were at because we had those days built in. But the state is allowing you to apply for a waiver and granting the waiver. We applied for the waiver and we were granted the waiver almost immediately in terms of hours of instruction. I don't know if we're actually going to need the waiver when it comes to the hours, because we are providing education to our students throughout the course of the day, and as everyone is at this point. So unless something happens where we can't provide that, then I think we would be okay, but we did want, they've been very good about the hours of instruction waiver. Yeah.
This question's for Lisa.
Yes.
So Lisa, how many people are currently hospitalized with COVID-19 in Eau Claire hospitals? Viewers have told us that there are at least 3.
So the question is, how many people are hospitalized in Eau Claire hospitals for COVID-19? I don't have that number. The state does work to collect that data, but it's actually more difficult than people realize. The number of hospitalizations fluctuates very regularly, and again, we get information about those Eau Claire residents that we are that are COVID positive, that we are working with and watching, and we update with them daily at least, if not more frequently. But the number of people hospitalized in Eau Claire County for COVID-19 is certainly not that number. It is a very difficult number to capture at any point in time because people come in and out of hospitalization at all different points. Any other questions? So again, thank you very much for being here today. We are in April, and we have many days ahead of us with the stay-at-home order. We do have many days ahead of us of dealing with COVID-19 in our community. We appreciate people paying attention and helping our healthcare workers, helping our first responders and others do their job, and make sure that we decrease the disease. Again, tomorrow we'll be talking more about election safety, so you can anticipate that at tomorrow's media event. And we will be back Monday through Friday next week, we are anticipating as well. So thank you.